Hey guys, Joel here. Hope you're all well. Thanks for watching my video. It's just going to give you some tips and ideas on how to cure your tennis elbow. Basically, a little bit about myself. I'm 28 years of age, keep active, love all sports. How my tennis elbow come on was effectively from weight training. I was doing 7-day sort of splits, was loving it, getting great results, and ended up getting an inflamed area around my right elbow. So my elbow pain started from the upper end of the forearm, slowly all the way over the elbow to the lower head of the tricep. It's pretty common in most people when they suffer from tennis elbow, that's where they're going to receive it. For my occupation as well, I obviously sit at a desk and type on a keyboard and use a mouse, so it's not going to help either. So you're consistently using your flexor muscles, which is going to inflame the area. Anyway, put all that aside. From my past experiences, I've had cortisone injections, which were meant to work. So I went to a physio. We tried all the rehab, normal general stuff first with exercises, ice, anti-inflammatories, painkillers, etc. Just wasn't getting any better. My physio said, look, let's try something different, whether it be shockwave therapy or cortisone injections. So, everyone's like, yeah, let's do cortisones. They're meant to work and just fix the injury. Look, guys, I just want to let you know that everyone's got their pros and cons on cortisone injections. For me, I'm glad I tried it. However, it just wasn't successful. So I had one cortisone injection which lasted approximately a month. The pain started coming back. Apparently, you're allowed to have 3 in the one spot, and it can take a couple of goes until it actually kicks in. So I had a second one after several months in between. You've got to have a little break in between there. Had a second one which lasted only a week. So cortisone for me just did not work. My body rejected it. My opinion is, look, there's pros and cons to it all. It will definitely mask the pain for temporary relief, but for long-term effects and management of the injury, it's just not going to help. So how can you fix it? Long story short, once again, my friend at work basically said, why don't you try some massage or go to a naturopath and try all these natural remedies, which I was like, oh, whatever, I've tried cortisone injections, I've had drugs or whatever and everything, and if that's not going to fix it, well, why would someone give me a massage or something of that sort fix it? Went to a naturopath, told her my symptoms, and she was so confident. She said, look, Joel, I honestly think I can help your tennis elbow. So what she did was, she was working on the forearm. She stuck needles in the upper forearm. So she would put about 5 or 6 needles. She'd leave it in there for about 15 to 20 minutes. She would work on my back, so it'd be deep tissue massage. Then she would do some trigger point therapy. So look, I won't get into it, but go see someone and they can talk you through it. It basically consists of just shoulders, triceps, right down to your fingers. And she was actually pressing some pressure points or trigger points as such in my back, which I could actually feel around my elbow. It's pretty cool. It hurts, but it's pretty cool to feel that, you can touch all around the body and you get several results and you can feel where the pain's coming from. I seen her twice. Didn't have the best results, but she was really upbeat, really confident. Mind you, I was really negative at the time, just over the injury because it put me back. She said, look, just come in for another session. I want to do 3 or 4. So this was my 3rd hit, and I just said to her, look, I don't think it's working. After today, I might just walk away, shake hands and goodbye. So she's like, yep, look, I just want to try something different. Point of this story is she ended up doing the same masseuing, the same trigger points, etc. However, she put the dry needling in the lower head of the tricep. She ended up putting about 6 needles in. Did the exact same time frame, left him in there, really worked the tricep as well, so a lot of massage in the tricep. So from my understanding, from reading and talking to people, the injury actually comes from your forearm or it comes from your tricep. Mine came from my tricep. So look, I was really shocked. I'm glad I stuck at it with this lady. I'm still seeing her today, so I go and see her every couple of weeks. Not only you leave feeling great, but it's managing my injury, which I think in effect that if you are a sufferer, that's what's going to have to happen. There's no cure as such just yet. I'm back weight training, which is fantastic. I'm just doing lighter weights, light to medium weights, and my rep range is sort of around the 10 to 12. And I just avoid anything that does give me pain. And that was her tip. She just use common sense and use your noggin and basically just do what you can do. If you do feel it, do feel any pain, I do jot it down, just put it in my iPhone, and just then when I go see her, I go talk to her about it. But guys, I hope you enjoyed this video. Look, it's nothing special. It's just what I've done and what I've learnt from tennis elbow. Like I said, in the beginning, I've researched and looked everywhere, and I just couldn't find anything or any help online or in books. But yeah, get to a naturopath, have a chat to them, just be open and honest. It's either going to come from your forearms or come from your tricep. Mine was from my tricep. I'm so happy that I've figured out where the actual pain is caused from. Getting management, getting really good rubs into it. The dry needling helps for sure. And yeah, good luck with it. If you've got any questions, just give me an email. I'll put it at the bottom of the page, jdelite@outlook.com, or hit me up on Facebook. More than happy to help. Good luck, guys. All the best.